We need to track the care and outcomes across organisations and really use those metrics to assess both commissioner and provider performance. Now, as I conclude, just a thought about, well, we've got all this evidence and we, in a sense, know what we need to do. Well, what stops us doing what we know we should? Now, I think as in many areas of life, you know, whether it's about exercise, weights, whatever it may be, I mean, I think there are always some who, annoying people probably, who will always do what is right and sensible. Others of us who need persuasion, but sometimes even mandate to do what needs to be done. And thus it is with organisations. So we're going to have to really think carefully about organisational behaviour, because it's not just about data and payment systems and contracts. And I know a lot of thinking's going on about sort of leadership development for the health service at the moment. Because, as I say, the cost savings and improved or at least sustained quality will only come about if behaviour changes. And actually, I think that the fairly dire financial picture that I painted earlier, but taken together with the Francis Inquiry report, I think they actually give us a real impetus to be getting in there and doing what in a sense is the core and really important health management task, to be making the changes to care that enable this both improved quality but some quite different patterns of delivery. And my very final slide, just to summarise, sees the 5 priorities of what needs to be done. I go back to this point about needing a compelling narrative about how care and services will be in the longer term. I think those of us within the system tend to understand all of this, but we've done a pretty poor job of sharing that more widely. Back to what I was talking about productivity, we have to be sure that we're making those transactional management efficiencies and clinical efficiencies before we can start calling for the difficult change. We have to be able to show we've been able to do that and tackle that within our organisations. Then we have to constantly emphasise the need to tackle unexplained variation in clinical and managerial practice. I think the public would be quite shocked often if they really knew how different the patterns of care or quality of care are across or even sometimes within organisations. We've got to incentivise general practice to work jointly with specialists to develop these new forms of urgent and chronic care. And finally, and for me particularly importantly, we've got to relentlessly track patient and carer experience and outcomes so that the impact of austerity measures is assessed and the overall focus is maintained. And at Nuffield, together with the Health Foundation, we're just embarking on a 5-year project called Quality in Austerity that's going to aim to actually do that, to provide some independent analysis over a long period of time of what is happening to the quality of health and social care in these times of austerity.